Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armin Budish, and from the Board of Health we have Health Commissioner Terry Allen and Medical Director Dr. Heidi Gullet. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you very much. Good afternoon. I again want to thank Board of Health Commissioner Terry Allen, Dr. Heidi Gullet, and their staff for all they do around the clock to keep our residents safe. Lately, we've been talking a lot about COVID testing. Testing is important to keep people around you safe. Let's say you're having family or friends over to your house. If you or a guest is COVID positive, you should find that out before you get together so you don't infect them. Before you go to a restaurant or get on a plane or visit with grandparents, you should first check to see if you're infected. This is critically important to prevent the spread of COVID. It's very important to put a stop to this pandemic. The Biden administration wants to make it as easy as possible to get a rapid test. Just yesterday, it launched a new website for all U.S. households to order 4 free COVID tests. You can order the tests online by visiting covidtests.gov. It's really easy to order. All you have to do is enter your name and mailing information, submit your order, and wait for the tests to come in the mail. The tests should be arriving toward the end of January. It's not only easy to order the tests, but it's easy to use them. Now, I know some people are hesitant because they think it's complicated or that it hurts. You don't need a doctor or nurse to do the rapid test, and it does not hurt. If I can do it, you can too. And to prove it, I'm going to demonstrate right now, or at least I'm going to try. I hope I don't mess it up. Each type of test is a little different, so you have to read the instructions. I'll use the on-go test, which is this one here. So first you wash your hands, which I did, and then open this little plastic rectangular thing. Take the little vial out and remove the aluminum foil off the vial. So here's the vial. Take the aluminum foil off. You can throw that away. You put it in the plastic container that all the stuff came in and set it up with the open end sticking out. Then you open the nasal swab, which looks like a Q-tip, and you take that out. Don't touch the soft tip. Now here comes the fun part. Put the swab gently 3/4 of an inch, not very far, into your left nostril. This is not like those medical tests that a nurse sticks way up your nose and into your brain. This is very gentle. Then slowly rotate it at least 5 times around for about 15 seconds. So you put it in the left side first, rotate it around a little bit, and then you put the swab into the right nostril and do the same thing. You put it in, you swirl it around a little bit, about 5 times. And then you take the swab and put it into the little vial and mix it around at least 5 times, sticking it in the little liquid at the bottom. You squeeze the liquid from the swab as you remove it. So you take it out, you squeeze the sides of the vial, you take the swab out and you can throw it away. You've got the vial here. You put the top, which is this little thing here, you put it on the top of the vial with the pointy thing sticking out, and you stick it in firmly. Then you flick the bottom of the vial to mix it up. Then you hold it over the little square that we talked about earlier. You hold it over the rectangle thing, stick it over the little square at the bottom, squeeze out 3 drops. 1, 2, 3. You start a timer. Put it down, start a timer, then let it sit for 10 minutes. You'll see 1 line appear in the area above the little square if you're negative. 2 lines if you're positive. I hope it's 1 line. And that's it. It's easy and it's painless. And let me tell you, it is very important. And with that, turn it over to Commissioner Allen.
Thank you for the live demo, Executive Budish. I think that was a great demonstration just how easy it is to perform a test and how quick actually it is to perform a test. Now, where there may be variations on tests, and sometimes there's a little vial, sometimes there's just a swab with some drops. What Executive demonstrated is it doesn't take long, it's easy to follow, and it's the smartest thing you can do to protect the people you care about. Testing is our way for many things that we do in our health world in terms of assessing risk, whether we're testing for lead among our children, or we're getting tested for strep or something at a doctor's office visit. This is an easy way to take this test home to make it accessible to all of us. So thank you for that demonstration. So we all know that the Omicron variant has swept through Cuyahoga County and Northeast Ohio, peaking around the first of the year, and has now spread, unfortunately, like wildfire to central and southern Ohio and other points. While news reports had described this variant as milder strain than Delta, many people in the path of Omicron have suffered its effects. As we described at our last briefing just a couple weeks ago, if you're unvaccinated and unmasked in indoor group settings, you're asking to be exposed to Omicron, which may be the second most transmissible disease in the world. This has certainly been the case in Greater Cleveland over the last month, where our cases have skyrocketed. Thankfully, our case numbers are continuing to drop from that peak around the first of the year at almost the same rate that they rose. What that tells us is that Omicron has burned through the population very quickly among those that were exposed. Over the last 7 days, Cuyahoga County has reported 10,000 cases of COVID-19, which also includes a backlog of cases from the state due to some reporting delays that occurred during the surge. Our case rate remains about 8 times the CDC threshold for high transmission. That's down from the peak of the Omicron surge, where we were almost 13 times the CDC threshold for high transmission, our highest numbers yet during this pandemic. Because of the high transmissibility of Omicron, CDC recommends the use of high-quality masks the highest quality mask that you could get. A surgical mask is better than a cloth mask, and certainly layering masks is better than a single mask. The federal government is working to provide up to 400 million free high-quality N95 masks to all Americans from its strategic national stockpile. The masks will be available through pharmacies and community health centers in the near future. And when we learn more information from the federal government, we'll be sure to share it with all of you. On the vaccination front, we saw an increase in the first and second dose demand, as well as for boosters around the holidays. But lately, we've seen a slowed rate of demand. And this is very concerning because the data is clear about the value of vaccination. People have said to us, if I can get Omicron, even though I'm vaccinated or potentially boosted, why should I get vaccinated? The reason you get vaccinated is because the Ohio Department of Health continues to report that since the beginning of last year, since the beginning of 2021, about 95% of the people in the hospital and 95% of the people that have died from COVID-19 were unvaccinated. So what the vaccine does is protect you against severe illness so that you can weather this thing at home. Remember that, and the testing helps to prevent you from exposing somebody else that could potentially be subject to severe symptoms, hospitalization, or worse. The number of deaths during this Omicron surge in Cuyahoga County has only been eclipsed by the number of deaths of last January in 2021. So what happens is when lots of people get exposed to a strain like Omicron, because it's such a large number, a small proportion of a large number is still a big number. And we ended up seeing, unfortunately, and very sadly, a lot of deaths during this last surge for Omicron. On the vaccination front, about 61% of all the residents in the county have been fully vaccinated. And the CDC definition, to remind you, for fully vaccinated is a single dose of Johnson & Johnson or 2 doses of an mRNA vaccine like Pfizer or Moderna. In terms of vaccine equity, we continue to work on that front and have more work to do with 40% of our African American population and 55% of our Hispanic Latinx population fully vaccinated by that CDC definition. The Ohio Department of Health is reporting that to date, only 21% of our kids aged 5 to 11 are fully vaccinated. And kids can spread among other kids and also to adults. So we also know from kids aged 12 to 17 we're doing better there with about 51% fully vaccinated. We strongly encourage parents to get their eligible kids vaccinated. CDC has also recently approved boosters for kids aged 12 to 15 years of age. Now, Omicron has caused a significant increase in hospitalizations among our children, and many kids still remain vulnerable. Consequently, we encourage all schools to continue to require universal masking for all students and staff during this unprecedented surge. It'll help to protect the health of their students and their staff. Many of us in the community, given the numbers we have, still remain unvaccinated and vulnerable to contracting Omicron. Vaccinations continue to be readily available from local health departments, pharmacies, community health centers, hospitals, and vaccination is always and will be the best way out of this pandemic. It also prevents, with vaccinations happening more globally, prevents the emergence of of variants that can emerge, new variants around the globe that can bring, that brought Omicron to us as well. So we need to also bolster our protection against these new variants by making sure that we get boosted and follow the vaccine schedules. The location and times of our clinics for vaccination continue to be available on our website at ccbh.net. And as always, you can call 211 to get an appointment for a vaccination or go to gettheshot.coronavirus.ohio.gov. Boosters for Pfizer, Moderna, and J&J are available for eligible recipients. And to date, about half of the people that are fully vaccinated in the population in the county have received boosters, which is, of course, the best way to protect against severe illness. So we want you to stay up to date with your boosters. And what does that mean? It means that you can get a booster dose at least 2 months after receiving your J&J vaccination, and at least 5 months after receiving a Pfizer or Moderna vaccination. So looking at flu activity, it's currently, according to our data, moderate, and reminding people the predominant strain circulating this flu season has historically been associated with an increased level of hospitalization. So get that flu shot. The flu vaccine can prevent complications like pneumonia and ultimately save lives, just like the COVID-19 vaccine. On the testing front, our positivity rate over the last 7 days is at 17%. And this is about half of where it was at the peak of the Omicron surge, at about 36% or so. Now, the hospitals saw even higher rates of positivity, around 50% during that Omicron surge. But that was our 36% was our community-wide rate among all the testing locations. As Executive Budish noted, we had the two announcements really from the federal government, the announcement about the availability of the 4 free tests at covidtest.gov. Going to covidtest.gov, you can access those 4 free tests. We also know that you can get up to 8 over-the-counter at-home tests per month, which must be fully reimbursed by your health insurance company with no deductibles or cost sharing. Packages that include multiple tests will be considered a single test for the purpose of reimbursement, and tests are covered if they're part of a clinical assessment by a healthcare provider. That means you get 8 free tests per month plus whatever number of tests the doctor asks you to take. These tests that you seek insurance coverage for need to be approved by the Food and Drug Administration. The Walker Center testing site that was run with the University Hospitals Cleveland Clinic, assistance also from Metro Health, and the Ohio National Guard has appointments that continue to be available this week, but will be closing after Sunday due to a reduction in overall demand. They're going to be then sending resources to Guard to assist other parts of the state that are currently surging. We're currently waiting for a shipment of test kits from the state, and they'll be sending to us when they're available. There's high demand for test kits nationally and across the state in particular areas that are surging. And so the state is prioritizing currently schools in the state to receive test kits first to assure that kids can stay in school learning. And we, as we receive kits, are prioritizing needs in high-risk settings among those that may be developmentally disabled, for contact tracing support, and for outbreak control in high-risk settings like shelters as well. Hospitals continue to be very busy, and we'll be hearing more about the clinical setting from where things stand from Dr. Gullet soon. They're running at still about 90% of their capacity to care for COVID patients, in addition to other seasonal illnesses and emergent issues like heart attacks or car accidents. The National Guard troops still supporting hospitals now have been essential to maintaining our community capacity, and hospitals have said they couldn't have done it without their support. They've had high rates of illness among healthcare workers, which has compounded the problem. People who otherwise would be admitted to the hospital for a condition in normal times may be required to stay home and communicate remotely with their healthcare provider and monitor their symptoms. Elective surgeries still continue to be delayed and visitation significantly restricted. So we want people to understand we're still at 8 times the CDC threshold for high transmission. We're optimistic as our numbers continue to drop, but the risk is high and our hospitals are still under stress. Our healthcare workers have been warriors during this pandemic, and their task has been particularly difficult during the Omicron surge. And we're fortunate to have such a dedicated group of clinicians in our community. So now I'd like to turn it over to one of our very own public health warriors, who I know has given everything she has during this pandemic, everything and more, to be there for her patients, and that's Dr. Heidi Gullet. So please hand it over to you, Dr. Gullet.
Thank you so much, Terry. Much appreciated. I'm fortunate to work with groups of amazing clinicians in this community, but I do want to spend a few minutes talking about the clinical perspective that we're currently seeing, and also helping people to understand the gravity of the impact on our healthcare providers and our healthcare systems locally. So we're currently still seeing, as you heard from Terry, a very high level of transmission. And so we really need everyone to do what's in their own power to help us stop that transmission. We're encouraged that our numbers are going down, but we're still at a very high level of cases, and that's impacting our health systems in really profound ways. We're seeing a lot of acute COVID infections, meaning infections that are recent, happening now in our primary care offices, in our emergency departments, and in our hospitals, and people who are admitted maybe for other things as well. We've certainly seen amount of that. So it's really important to recognize that if you're sick, you may be transmitting this, and it's really important that we ask you to stay home and also seek testing in an outpatient setting if you can. The other thing we've been seeing a lot of, and particularly in primary care, is long COVID syndrome, which is where people have an acute COVID infection and then the symptoms persist and sometimes new symptoms develop over long periods of time. And in many cases, this has left people very debilitated. They're not able to live the lives they lived before their COVID infection. So the health system is both dealing with a very high level of transmission and acute COVID cases, and in unvaccinated people in particular, very high risk for lots of issues with breathing and needing admitted to the hospital, oxygen support, and other supportive measures. We have very limited amounts of treatment at this point. We have limited ability to give infusions of monoclonal antibodies, and we have very limited courses of antiviral treatment. So while we're hopeful that these treatments will increase in the volume, we don't have enough right now to go around. So stopping transmission and preventing future infections is our best bet here. We're also seeing a significant impact on children. We've had quite a few hospital admissions for children with both acute COVID, but also children a few weeks out, 2, 3, 4 weeks out from their initial infection, developing MIS-C, or a multi-system inflammatory condition that has really impacted them. Sometimes these children need specialized care, and they need that at our local hospitals. So it's really important to recognize that it's not just about the acute COVID infection, but it's also for both adults and children about these long-term effects. This is still an emerging virus. We've learned a lot about it in the last 2 years, but we certainly don't know all of its impacts. And I personally have seen far too many people, children and adults both, impacted in very profound ways that have affected their quality of life. We don't want that to happen to anyone, so we really ask for your help in stopping the transmission. In addition to just having a higher number of patients during this most recent surge in our hospitals, the number of healthcare workers that have been impacted by COVID is substantial. We have been working with very limited staff. That's both the inpatient setting, in the emergency departments, and also out in community primary care. We're working with sometimes a small sliver of the number of people we need to actually conduct our regular office hours. So we're doing everything we can to meet the demand and ensure we have testing and vaccine availability. But please recognize that whatever's happening out in the community is also affecting our healthcare workforce, our first responder workforce. We meet every other Tuesday with our first responder workforce, and they have been tremendously impacted by the number of COVID infections among their own staff, which impacts the ability for them to respond to you in an emergency situation. So we have to recognize that protecting yourself and protecting your family and protecting others is protecting our healthcare workforce and our first responder workforce. It also has limited the ability of hospital beds for emergencies that are non-COVID related. Sometimes people have to wait for long periods of time when they need a hospital bed. They may be staying in the emergency department, which continues to happen even this week. That's because we either don't have enough staff or we don't have enough physical space for folks. And it's really important that we try to limit the number of COVID infections so we can address those emergencies that will inevitably come up, things like heart attacks and strokes. So I would ask that you have a lot of patience with our healthcare organizations, our healthcare teams. We are all exhausted. It has been a long 2 years, and we are all committed to caring for everyone in this community, ensuring no one is left behind and everyone receives the clinical care that they need. But we're also tired, and we're working with limited staff. So I would just ask that you please be patient and please be kind. Our staff have endured a lot of abuse and frustration, which is understandable. We are all frustrated, but they really do need extra patience when they're trying to help you in the event of an emergency or any care that you need. I also want to just talk for a minute to reiterate what you can do. Sometimes in these situations, it's a little bit like, I feel powerless. What can I do here? But everyone can do something. Regardless of your age, you can do something. If you're sick or your children are sick, we ask you to stay home or keep your children home. It may be COVID, it may be influenza, it may be another respiratory disease this time of year, but we need you to stay home so that it doesn't spread. We also ask you to please consistently wear a high quality mask. It's essential to wear a mask at this point in time, and it will also keep you from getting the flu or other circulating viruses. This is essential for your protection, but also the protection of your neighbor and others you encounter. We also strongly encourage testing, and that testing is either in the form of a rapid antigen test that you saw our county executive demonstrate for you, or in the form of outpatient testing. There are quite a few places in our community where you can access testing. With our volumes coming down as far as acute cases, there is availability in many places. I checked before today just to see what it looked like, and I could easily get a test today. So those tests are either drive up or in an outpatient setting. We ask that you still do not go to an emergency department for testing unless you have a true emergency. They are not providing testing for people who will not be admitted to the hospital. Finally, we also recommend, if you can distance, do that. If you need to be in an in-person setting, please distance. Ensure that you're far enough away from your coworkers and you maintain that masking. But if you're able to work virtually or hold meetings virtually, that's strongly recommended. And large gatherings should not be occurring while we're in such a high transmission period. Most importantly, vaccination is our way out of this, and that remains the case ever since the beginning. Vaccination is critical and strongly recommended for everyone age 5 and older. The COVID vaccinations we have available are safe and important to prevent you from obtaining the most serious impacts of COVID-19. It is not too late for your first dose or your second dose or your booster dose. If you've already had your first dose of Johnson & Johnson or your first 2 doses of Pfizer or Moderna, it's essential that you get your booster. The immunity that we get from vaccines, certain kind of vaccines, wanes or decreases over time. That's why we get a flu shot every year. That's why we get boosters of other vaccines, just like varicella or chickenpox later in our lives. So it's essential that you get that booster. Really important while we have so much Omicron spreading. The vaccine protects you from those most serious impacts of COVID-19 that are vaccine preventable and is absolutely your best protection. And as Terry mentioned, it's also an excellent time to get your flu vaccine, and we strongly recommend that you get that as well. And you can also get that at the same time that you get your COVID-19 vaccine, regardless of which dose it is. It is safe to get them together, and we strongly recommend that you do that, and it'll save you an extra trip. Finally, in my moment of gratitude, I would like to thank all of the team members of the Ohio National Guard that have tirelessly worked over the past few weeks here in Northeast Ohio, where we have desperately needed you. We have watched you as you've cleaned floors and handed out food and provided clinical testing services and staffed lots of locations for our community, and we'll be forever grateful for that. We know you're headed out to the southern part of the state, which is having another surge just a few weeks behind us. And we just want you to know how grateful we are here in Northeast Ohio for your critical care at a really vulnerable time in our community. With that, I'll turn it back over to Devin for questions.
Thank you all so much for your remarks. We now have a few minutes for some questions. Just a reminder, please state your name and media organization, and remember to stay muted when not speaking so we can take a question.
Yep, and I just want to take a second here. I don't know if you'll be able to see this. This is the results, how you read the result. There's one little thin line. I don't know if you can see it. Can you zero in anymore?
As far as we go.
This is as far as it goes, but there's one line which shows that I'm negative. So that's the good news. Sorry to interrupt.
Any questions from the media? All right. Well, thank you all very much. That concludes this week's briefing. Thank you so much for joining us, and we will see you in a few weeks. Have a great day.